And now it is my honor I'm going to introduce the student speaker. And I'm going to put the floor over to Paridhi Badjatiya, and she is going to share with her classmates and everyone watching a little speech for everyone. All right, the floor is yours.
Thank you. I didn't expect 150 participants, but I'll go with it. Give me one quick second. All right. Hello, everyone. My name is Paridhi, and I'm a nursing student. Oh, wait, I don't have to say a student anymore. I have all the power now. It is such an honor to stand here before you all today on behalf of this amazing June ABSN nursing class of 2020. Woohoo! We did it, guys. Thank you, everyone who's here to share in this momentous occasion of our pinning ceremony that carries so much significance, not only for us, but for nurses everywhere. Reflecting back to the first week of nursing school, it was interesting how quickly the pace changed. First day was orientation, about 100 introductions, reading the syllabus, that type of stuff. Then second day, we spent the entire day learning how to wash our hands, which the whole world is doing now, by the way. Next day was blood pressures and temperatures. And we were all like, nursing school is so fun, right? Fun. Then all of a sudden, day 4, we had 15 chapters to read, an 8-hour care plan to do, needed to learn some 50 meds, start doing 100 practice questions a day for NCLEX, which was still 1 year away. You get the idea. In the beginning, they tell you to go to the bookstore to buy the book bundle. You would imagine it to be a cute little bundle of a few books. We had 700 pounds worth of books. I go to the bookstore to get my bundle. They tell me, you got a truck, right? Oh, good. Just pull it around the back. We load it up for you. I totaled up all the pages we were supposed to have read according to the syllabi. Some 8,500 pages. And my friends wonder why I haven't been outside in 1 year. No, I'm not agoraphobic. I'm just a nursing student. Then the much awaited clinical started. First time dealing with urine, loose bowel, sweat, vomiting, and difficulty breathing. And I'm not talking about our patients. That was just us before we even entered the hospitals. Once we were taught IVs in the second semester, we were often in public nudging each other, saying, hey, check those veins out. We have had many firsts. The first time I carried someone's stool around that was not made out of wood or metal. The first time I wiped someone else's butt that was older than 2 years of age. The first time we ever touched a stranger down there, nonetheless, that was to shove a rubber tube in them. Crazy. We have our share of blood, vomit, open sores, nasty wounds, stinky feet, and bunches of feces. Code brown. But thanks to Dr. Smith, who taught us how to use our nurse face, that's when you walk into a patient's room and start to gag or catch yourself saying, oh my God, that's disgusting. You cannot do that as a nurse. You just have to take a deep breath and then just put on your nurse face and say, I'd be happy to help you with all of that. I remember how Dr. McAdam would sometimes teach us 15 minutes extra and would jokingly say that I would one day return these 15 minutes back to you guys. And how Keto would politely ask her if it would be okay to show up 15 minutes late the next morning. I remember how Professor Rosa used to try to de-stress us before exams. She would lower the lights and have us take deep breaths and put on some stand-up comedy. And it was amazing. But somehow, I just sat there thinking about all the information slowly draining out of my brain. I just crammed it all in there the night before. We would remember Dr. Santos's generous extra credit points, or Professor Khare's direct text messages to us, Dr. Camerano's witty research class, Dr. Klein's engaging disease stories, and of course, Professor Thompson's fun mental health lectures, or Professor Koning's podcasts or Popular Jeopardy, and of course, how cool, friendly, and approachable Professor Abdugraph, aka Deb's teaching style was. We'll miss Leah's yoga sessions and Michelle's choreographed TikTok dance. We'll miss Dante's sassy comebacks. Andrea's dog named Samuel Merritt. Sorry. And Jackie's camping and studying super late at school. We'll miss the clinical carpool rides, watching our first baby delivery, or texting each other to say, "Can you hold the door? I forgot my badge again." Or, "Can you airdrop the lecture recording, please?" Or simply celebrating at Wurst Hall, the swinging door, or the Marriott next door after each HESI was done. So for those of you who are not familiar, nurses have some common things they love to say. I can't tell you how many times I've heard nurses say, "There's the NCLEX way, and then there's the real world way." Or, "Whoever invented the call light will have a special place in hell." Plus, I cannot explain to you the dichotomy of talking to my husband about encephalopathy, seizures, irritable bowel syndrome, or COPD. Not really dinner table conversations, I guess. We all need nurses. Nurses are really special. You can tell if a patient has no nurse and only a doctor. There's no one to say, "You want to give how much propofol, doctor? Are you crazy? You are not coming near my patient." Just kidding. Among other things, this past year, the mandatory 73% on each course, or else get kicked out of the cohort. The HESI exit score of above 850 while handling the wonderful, wonderful Proctor U proctors. The struggle was real. We all pulled many all-nighters, countless hours of studying, limited to no sleep, weekly exams, missed celebrations, and being exhausted beyond belief. It wasn't easy, and I'm so proud of us for pulling through all that pressure. At one point or the other, we have all self diagnosed ourselves with stress overload related to sleep deprivation, social isolation, and imbalanced nutrition, as evidenced by being an SMU nursing student. And these trials and tribulations have also given us the courage, the confidence, the strength, and the wisdom we need to become outstanding nurses. Our cohort was truly inspiring, with folks from all walks of life, all ages, personalities, and backgrounds. Former EMTs, CNAs, dietitians, biologists, techies, doulas, people from finance background, fitness, design, you name it. All of us have a unique story of what compelled us to get into nursing. Some of us are parents, some worked throughout the program, some are expectant moms and dads to be, some got married, some got engaged, and of course, finishing school during this unusual and historic time of a pandemic and fight against systemic racism, inequality, and injustice throughout the world. We were resilient and powered through all the obstacles to reach the finish line, students, teachers, and staff alike. We are a strong, intelligent, and compassionate group, if I could say so myself, because nursing tends to attract people who love science and medicine, people with good hearts, people who are compassionate, people who want to provide holistic care, pay it forward, give back, and help the communities and the world one patient at a time. As a crazy adventure here at SMU comes to an end, we have all grown in ways we could have never imagined and feel very prepared, all thanks to the quality education we received here at our alma mater, the Samuel Merritt University. I would like to end my speech with an abundance of gratitude. Thank you to my incredible classmates and friends and my little nursing family. Thank you to our amazing class reps, Cassie and Ryan. Woohoo! Thank you to all of our wonderful and extremely talented nursing mentors, our lovely clinical instructors and teachers, and the entire staff here at SMU for your priceless support and knowledge, and for always cheering us on. I want to especially thank Dr. Smith and Dr. McAdam. Thanks for everything you did for us. We love you both immensely. May we make all of you incredibly proud. Thanks to Bukola, Andrew, Karen, and Nancy for their endless support. And thank you to my boss, Catherine Leroy, for giving me the opportunity to represent the SFPC campus as a tutor coordinator during my time here. It was my honor and an absolute pleasure. And of course, a huge, gigantic thank you to all of our friends and families who have supported us and had to put up with all of our crying, complaining, and frequent episodes of hysteria and delirium. Just one shout out to my husband, Chirag, to my little girls, Arya and Yara, and my amazing mom and dad-in-law. I love you guys. and I couldn't have done this without you. Also, thank you for everyone here today, especially family and friends who are tuned in from different time zones all over the world. So again, let's give it up for the amazing June ABSN class of 2020. Thank you, guys.
Thank you, Paridhi. That was awesome. Hearing that accurate nursing diagnosis put a smile on my heart.